The Nurses Association of Jamaica, NAJ, is calling for dialogue to discuss how the COVID-19 vaccine will be administered when it gets to Jamaica. However, doctors have a slightly different view. Shamela Pullen reports.
The United States and the United Kingdom are leading the way in administering COVID-19 vaccines. It's still unclear when this will begin locally. But when it does, some frontline workers say they won't be first to get it. Patsy Edwards-Henry is the president of the Nurses Association of Jamaica.
Trials for vaccines and any other medication usually take years. These trials have gone pretty fast. So we're not averse to having the injection, the vaccine. It's just that coming from a society where we are sometimes overly cautious, we have persons on the front line who may be fearful. The public health nurses who will be responsible for administering and getting the public's buy-in have not yet been sensitized, have not yet had a meeting with the minister or with the ministries or with the regions as to how this rollout will go.
The NAJ's position is in contrast with the first person to get the vaccine in the U.S., Jamaican Sandra Lindsay, an ICU nurse in New York.
I feel great. It doesn't feel any different than the influenza vaccine I take annually and that I took 2 months ago.
Moderna's COVID-19 vaccine, which Jamaica is seeking to access, has been declared safe and 94% effective by U.S. regulators. This clears the way for emergency authorization. A few weeks ago, scientists made a breakthrough in the creation of the Pfizer vaccine, which shows 90% effectiveness. But doctors have expressed confidence in the vaccines.
I would have to say the MAJ is generally in favor of it. We would like to see more details, and the government definitely needs to do a lot more in terms of public education and education among the various groups. It was alluded to earlier that the National Council on Vaccination was announced by the minister. The NAJ is a part of that, or has been invited, as have the MAJ, Medical Association of Jamaica, and various other groups. And certainly we look forward to those meetings, which we hope will be held in a timely and regular fashion.
Meanwhile, 3 more persons have died from COVID-19 in Jamaica. This pushes the number of fatalities to 276. 83 new cases of the virus were confirmed on Monday. The country's COVID-19 case count is now at 11,875. Shamela Pullen, TVJ News.